So I know that as we are learning to do new assessments, sometimes it can be difficult to put what we read into a hands-on practice. So I have asked for a volunteer here who's going to allow me to illustrate what we're going to do when we conduct a head and neck assessment. So first of all, we're going to start by looking at the face, and we might, observe the symmetry of the eyebrows, the eyes, the nose, the mouth, the jawline, all of these things, and we're looking for obvious asymmetry in different areas. We're going to ask the patient to smile. Could you smile for me, please? And when we do that, we're going to notice whether or not the muscles go up simultaneously and they are symmetrical, because this can indicate a problem with musculature, such as might result in a stroke, where they lose part of that ability to do so. First thing we're going to do, once we have taken a history and we've observed and inspected for obvious signs of lesions or drainage or problems with asymmetry or other areas, we're going to start by palpating the skull. So we'll start from the top, work systematically downward. We're looking for any sort of abnormalities, and again, we're looking for symmetry. We are also going to palpate the temporal area, which should be located, if you'll slide your fingers down, right there, just behind the eye. You should feel like an indentation, and that's where the temporal artery is going to run through. So you can actually palpate it and feel the pulsation of the temporal artery. Next, we're going to come down to this temporomandibular joint, and we're going to feel that joint and make sure, again, that it's symmetrical. And we're going to ask the patient to open their jaw. Could you please open your jaw? And what you're noticing is fluidity of movement and the ability to open and close the jaw without any pain or difficulty. Next, we are going to evaluate the lymph nodes, and we're going to begin with the preauricular ones, which are right in front of the ear. And since we've already been at the temporomandibular joint, we're already going to be in position to do this. So we're going to use a gentle motion with our little pads of our fingers, and we're going to palpate there. And I then will move back behind the ears to the back of the skull, and then we can move down this musculature at the back, and then we can move down the front, and then finally end up by palpating underneath the jaw. Now you can review the anatomical structures there to notice where the different lymph nodes are located and what to call them when you're charting if you notice that there is an abnormality, such as a swelling or a hardness or a lump. We are going to end with palpating the supraclavicular nodes right here, and any sort of lymph node in that area that's swollen is going to be an abnormal finding, because normally you don't feel lymph nodes in that area. Then we are going to assess our patient's range of motion by asking them to move their head in the 360-degree pattern to assess whether or not they have any difficulty with this. So I might say something like, "Sir, could you please now place your chin on your chest, and then beginning from that position, move your head around in a 360-degree format so that I can see how you are able to move your neck." Excellent, thank you. And you can sit up straight. Now what you'll notice is that he is able to move his head without any difficulty. What you are going to ask your patient at that point is whether or not there was any discomfort or pain experienced while moving, and you've already assessed whether or not he was able to do this as he moved his head and neck. Was there any discomfort or pain that you experienced while moving your head and neck?
No.
Okay. You might also assess the muscle strength, and you may remember this was part of our cranial nerve assessment, and you do this by placing your hand against one side of the jaw and asking the patient to try to move your hand. Could you please try to move against my hand? Good. Now try this side. Basically, you're looking to see what the muscle strength is, and your patient should be able to push against your hand and still able to move his head to the side or to the other side. Did you experience any pain when you were moving against my hand?
No.
We are also going to evaluate how centered the trachea is by placing our finger at the sternal notch on the patient, and we're going to notice whether or not there's deviation from the midline. We're going to place it again displacing this trachea slightly, and also looking to see if there is any deviation of the trachea. We should not find any deviation of the trachea. To evaluate the thyroid, I do believe a posterior approach is probably the best approach, but the book does show how to do it with an anterior approach. I am going to illustrate a posterior approach though. We're going to ask our patient to sit up straight, please, and slightly bend your head a little bit forward, just kind of relax it, lean it forward and a little bit to the right. And I'm going to take my left hand, not quite so much if you don't mind, I'm going to take my left hand and place it next to the trachea. And I'm going to displace the trachea slightly with my left hand while I take my right hand and push against it between the trachea and the sternomastoid muscle. I can feel at that point the actual thyroid gland, and I can displace it the other direction as well and feel the other side of the thyroid gland, the left side. What I'm looking for is I'm looking for symmetry again, and whether or not there are any nodules that are present. And I might even ask my patient to swallow. Go ahead, swallow please, and feel the thyroid going up and down. So this is how you can evaluate the size of the thyroid and whether or not there are any masses present. If I do notice any sort of enlargement of the thyroid, then I might take my stethoscope and actually auscultate it with the bell of the stethoscope to listen for any bruits that may be present, because when there is a hyperthyroid state, there will be an increased blood flow and you might hear a swooshing sound with your stethoscope. Thank you for assisting me.